live stream. Please share, subscribe, hit that like button for me. And we got to dive into this, video. You know, um, I want to say this to you guys, man. We have a corrupted system, you guys. You know what I mean? That America, that y'all all know, that's a corporate system, and lots of Americans are going to die. Vaccine expert speaks out after resigning from CDC. Now, according to reports, it says if the policies of Health Secretary Robert F. Kennedy Jr. are reversed, a lot Americans are going to die as a result of vaccine preventable diseases. Unfortunately, that quote is not attributable to Chicken Little. Instead, it is the opinion of Dr. Haver, formerly a top scientist at the Center for Disease Control Prevention, who resigned from the agency Monday. In her first interview after leaving, Haver told the New York Times that Kennedy attack on science and how scientists is conducting will have dire consequences. So it says it's a very transparent process, and they have just taken a sledgehammer to it in the last several weeks, she says. CDC process are being corrupted in a very that I haven't seen before. At the CDC, Haver oversaw the teams that collect a data on COVID-19 and RSV hospitalizations are helped did craft national vaccines policies. It says in a goodbye email to her colleague that was seen by. Now it says Haver says she no longer have confidence that her team output will be used objectively or evaluated with appropriate scientific to make evidence-based vaccines policy decisions. It says Kennedy attack on vaccinations and coupled it with the shocking firing of all 17 members of the Advisory Committee for Immunization Practice earlier this month helped persuade her to go. The health secretary has since named 8 replacements to the influential panel. Amongst them are scientists who have criticized COVID-19 vaccines, a critic pandemic era lockdown, and another person the Associated Press described as widely considered to be leading source vaccine misinformations. It says, I could not be parting this new committee. Haver told the Times, I have respect for my colleague at CDC who stayed and continued to try and limit the damage from the inside, she added. What happened last week was the last straw for me. Asked to respond to the concern Haver raised in her resignation email, a Department of Health and Human Services spokesperson told CBS that under Secretary Kennedy leadership's HHS is committed to follow the gold standards of scientific integrity. Vaccine policy decision will be based on objective data, transparent analysis, and evidence, not conflicts of interest or industry influence. Now let's go, man. Let's roll this clip, you guys. We got a lot to cover, man.
System, unfortunately, has been corrupted and influenced by excess power of big corporations. That's really at the root of the problem. Your turnaround on the vaccine.
See, the root to the problem is that the system has been corrupted ever since when Anthony Fauci stepped down, man. It's been corrupted by elites pushing this agenda, y'all, pushing the COVID vaccine. And many people, you know what I mean, will be forced in taking the vaccine. And this will raise, you know what I mean, high numbers of why people will be vaccinated. Because they're going to lie to you guys. They're going to say vaccine is a way to kill patients, to have this cure for patients. But it's going to backfire and it's going to kill many Americans, you guys, when they force this pandemic. I told you guys, man. I told you guys in my last video, you got to understand how they will push this gender. So let's roll this clip, you guys. You know, you guys gotta listen to what they saying. The elite will push this gender out. You know, so part of their Project 25. So let's roll this clip.
And your claim that it causes more harm than good. Yes. That is obviously a view that is not held by the vast majority of medical opinion or academic opinion. If you're saying that the vaccines haven't saved lives, that's patently untrue. I worry for the people in America, and I worry for my friends and colleagues that I know. Given what you said about vaccines, are you going to go to America and say we should ban these mRNA vaccines for COVID? Absolutely. One of the first things we're going to do is we're going to say, listen, this is the evidence. We need to pause. So you will stop it? That is the plan. Hello and welcome to the forecast. Aseem Malhotra is a deeply controversial British cardiologist who has just been appointed as Chief Medical Advisor of the Make America Healthy Again campaign group, co-founded by Robert F. Kennedy Jr. It makes him one of the US Health Secretary's most influential medical advisors, and that's alarming doctors and academics around the world, because Aseem Malhotra, like RFK Jr., goes against mainstream established opinion on many topics. Most controversially, he opposes the mRNA COVID vaccines, claiming they cause more harm than good, and he wants to end their use in America. Hello, my name is Adam Ferrari, Chief Executive Officer of Phoenix Energy. I look forward to you joining us. Even though people are still dying with COVID around the world. In the UK, hundreds of people are dying with COVID every month. Yet Malhotra claims the virus is no longer deadly. And that's not all. He supports RFK Jr.'s decision to reinvestigate the totally discredited claims of a link between vaccines and autism.
Look, you guys, they're gonna bring this pandemic out, y'all, and they're gonna tell y'all it have a cure for cancer. They're gonna lie to y'all. They're gonna say, "Oh, COVID, you know what I mean? We'll have a cure for cancer. We'll have a cure for autism," and they're gonna be pushing this. They're gonna be pushing this gender on our little children. So, you guys, I'm bringing this video out. This is one of the most important videos. You guys, please share this, man, because they're gonna be pushing this gender out on our children. They're gonna be trying to say it's a cure for autism. It's gonna be a cure for cancer. They're gonna tell y'all they're gonna be a cure for a lot of things, man, because they're gonna force this vaccine. I'm telling you guys, man, what Satan's gonna do. It's gonna force this gender, man. Hear what they saying, y'all.
Amid alarming levels of vaccine skepticism in America and outbreaks of deadly measles. Now, many people will question whether a vaccine skeptic in the medical profession should be given a platform like this. But it's the platform he's been given in America which makes him powerful. On this forecast, we'll examine his claims and scrutinize them by also talking to Stephen Griffin, Professor of Virology at Leeds University, who's a leading scientist in Britain and believes the claims being made by Malhotra and RFK Jr. are not just wrong, but dangerous. I started by asking Aseem Malhotra what job he'd been given. So I've been given a role as Chief Medical Advisor to Maha Action, which is a non-profit organization that essentially works at state level to do research, educate, and legislate for the purposes of making America healthy again. That's what Maha is? Absolutely. And what will the role involve?
my role essentially would be to synthesize and analyze data on how to translate the best evidence into policy for reversing chronic disease, because that's obviously the main focus of MAHA. All the different levers that need to be pushed, whether it's around legislation on ultra-processed junk food, whether it's on how to improve quality care within the healthcare system itself, because there's a big problem of over-medication, whether it's about also highlighting issues around lack of good quality data or independent data when it comes to doctors giving prescriptions.
So as advisors, or is there power?
No, there is. We are essentially, in many ways, we are an influence, an educator, and a lobbying group for the purposes of MAHA. So we will be speaking to senators. We will be having conversations.
Trying to persuade states to take these
Absolutely,
measures.
absolutely. So we will have the ear, if you like, of the senators and congressmen.
I mean, it's quite an amazing sort of transition for you. You know, you kind of got in with this whole movement in America over the last few years, I suppose, through COVID. I mean, how do you know RFK Jr.?
Really good question. So in 2022, and the backstory here, Christian, is I was somebody, and this is really important to get this clarity in the narrative as well, from my perspective and for people to understand this. At the early 2021, I was one of the first people to take 2 doses of the COVID vaccine. I assisted in a vaccine center. I felt I was doing it not because I felt I was at risk, but because it was my duty to protect patients. So for me, there was really no question in my mind there would be an issue. I was a bit skeptical about efficacy, but
I want to say, man, you got to be skeptical, man. You know what I mean? Because look, man, if they push this gender, which they're going to push it, they're going to push this vaccine, and many Americans is going to be unaware, man. Because they're going to tell you that, oh, we found new studies of the vaccine that it have a cure for cancer, it have a cure for autism, and they're gonna be saying a lot of things to have you guys believe that the vaccine have a cure. So don't believe. I'm telling you guys right now, when they push this gender, don't believe it, man. Because you guys, I'm telling you, there's gonna be so many Americans gonna die, man. And that's the agenda. They pushing this gender so they can kill off millions of Americans, man. Just like they did it when they brought in the vaccine 2019. So you guys, I'm letting it be known. I'm telling you guys firsthand, man. So when they push this gender, just believe I told you. Because they're gonna push it, and they're gonna make it sweet like they did last time, y'all. They're gonna pay some of y'all Americans $200 or $300 in your pocket to get vaccinated. I'm telling y'all, man. I'm telling y'all how they're gonna push it, man. I'm telling y'all how they're gonna push it, man. So, keep in mind, y'all. Keep in mind. Let's go.
But I didn't think there was going to be harm. Things then evolved. By the summer of 2021, my father, who was a vice president of the BMA, had an unexpected cardiac arrest and died. There was actually an ambulance delay involved in his death, and that was
Palace Chuck, he used to come on the program.
Yes, absolutely. And obviously, he was the last survivor of my immediate family. It was obviously devastating for me, but I was shocked, one, because he was a very fit guy, and two, I was also involved, unfortunately, in the circumstances where he had a witness cardiac arrest with 2 doctors doing CPR. Ambulance was on its way. He should have survived. The ambulance was delayed. So that obviously contributed to his death, but his post-mortem findings didn't make any sense. He had severe coronary artery disease. There's been an acceleration compared to previous scans. Several months later, research was published in one of the prestigious cardiology journals called Circulation, and they basically showed a mechanism of how the COVID vaccine increases inflammation of the heart arteries, which could accelerate heart disease. And it was pretty interesting research. And I thought, this makes sense now. If this is true, we are now going to see increasing death rates from heart disease and heart attacks. I spent months looking into this into detail because I knew I was up against something really big here, a complete change in the narrative, me reluctantly having to change my mind, having felt almost angry to some degree that anyone was questioning the vaccines. I had to go through that whole psychological process, but the evidence was there. I published in a peer-reviewed journal, independently analysed, so I maybe had my own bias because my father died.
I mean, you've got to be careful when you talk about prestigious magazines and peer-reviewed journals, because there's lots.
Let me tell y'all something, man. When this vaccine comes, man, when they push it, it's going to force a lot of Americans in order for you to even work in the United States. I'm telling y'all going to have to be vaccinated. Y'all better pay attention when they're going to push this gender out. You know what I mean? Order order for you to work, you're going to have to be vaccinated. Order for you to buy, rent. I'm telling you, this is in the Revelation. If we're not in the Revelation, y'all need to take heed into this, man. This is the gender that they're going to push out. Y'all better pay attention, man. Y'all better get into that Revelation and read every bit of that Revelation chapter, man. I'm telling y'all, I'm urging y'all right now, read that Revelation chapter, man. It's a couple of you guys already left, like y'all don't want to hear it, but it's okay. It's okay. You know what I mean? Because when millions of Americans die, just remember I told you guys this, man. Y'all better be taking heed to this, man. You know what I mean? Cause this ain't no joke, man. This is Satan's agenda, man. I tell y'all, man. I tell y'all, man. The Most High won't, you know what I mean, God's people to come out, you know what I mean, come out of her, man. Come out of her ways of living, man. Because I'm telling you, man, when they force the vaccine, man, and they force the government shutdown, I'm telling y'all, man, me America is going to be forced to take the vaccine because they're going to tell you. They're going to tell you, man, you know what I mean, that new study that we found the cure. I'm telling y'all, man, y'all better take heed, man. I better take heed because when they find a new study and tell y'all that the vaccine have a cure for autism, and they aiming this at our children, y'all. You know, what I mean, they force it. So I wouldn't recommend taking your children to the doctor to get checked. I'm telling you how they gonna force it. They gonna force it on our children, y'all. Y'all better share this, man, because this is some serious, you know what I mean, stuff, man. That they're gonna push this gender out on our children's, man. So y'all better take heed, share this video, man, and read every bit of that Revelation chapter, how Satan's going to require people that's going to be rich, poor, slave, free. It's going to get to a point for your housing situation. You're going to have to get the vaccine, man. And many people going to go for it. I'm telling y'all, many people going to go for it, man. Many people going to get the vaccine to rent, buy property. I'm telling y'all this, man. I'm telling y'all this, man. Let's go.
To different journals.
There is.
There are very established journals like the British Medical Journal.
Yes.
There are offshoots of that. There are things that are owned by. So, and I know you kind of want people to say, you know, when you use that language, that this is kosher,
Yeah.
if you like, for want of a better word.
You're absolutely
They're all
correct.
disputed as
You're
well.
absolutely correct. Long story short, for me, it became clear that there was good evidence saying more harm from the beginning. We should at least pause. I went on GB News. As soon as I come out of the studio, I get a missed call. I call it back. It was an American number. I'd had no interaction with this person before. It was Robert Kennedy Jr. He got my number from someone. He'd hear what I'd done. He said, Asim, Dr. Malhotra, thank you for your courage. This is Robert Kennedy Jr. And after that, we then built a relationship in the sense I went to America, I gave talks.
You've become big in that whole sort of sphere of that, you know, that sort of MAGA crowd.
Yes.
Tucker Carlson, Russell Brand. Not that he's MAGA, but you know that whole sort of. That sort of is an alternative media world,
Of course.
which has really built your profile. It was your turnaround on the vaccine, and your claim that it causes more harm than good.
Yes.
That is obviously a view that is not held by the vast majority of medical opinion or academic opinion, or the World Health Organization, or any of those sort of
Sure.
bodies.
Okay.
You think they're all wrong?
No, I think, listen, I don't think they're all wrong. The people that I've interacted with who share my concerns also can include the new director of the National Institutes of Health, Jay Bhattacharya. There is
Yes, but who's also a very controversial figure who was behind the Barrington Declaration during
Sure,
COVID and all of that. I mean, you know, these are tight.
But he's been proven to be correct. The mainstream.
Well, what I'm saying is that the mainstream opinion
Yes.
doesn't share this view. They say it's obvious. Look at the deaths from COVID. It is clear that the vaccine did more good than harm. Yes, there was harm. It was in small cases. Yet
Pete to play what he's saying. He said the vaccine did more good than harm. The vaccine killed millions of Americans. It didn't do no good for people to take it. And why would they push this gender out, man? Telling y'all, don't believe the lies, y'all. Don't believe these lies, man. If they didn't have a cure for the vaccine, 2019, what make you think that they're gonna have a cure for it? What makes you think that they're gonna ever have a cure? It's Satan's job is to steal, kill, and destroy. Y'all better get into that revelation. I recommend you guys read that revelation over and over till you have a understanding of it, man. Because look, this look at it, man. FEMA, they narrowing things down, y'all. They want to number things down, man. They want to narrow it on down. No more FEMA, no more WIC, no more food stamp, no more Medicare, none of that, y'all. All that stuff gonna be cut, y'all. And then they're gonna force the vaccine on y'all and tell y'all, well, we found a new solution. We found the vaccine have a cure for cancer and all. They lying to y'all. They're already lying to y'all. They're already cutting out the middle class. And the only thing is for you guys to do to get vaccine, y'all. This is a dangerous game. I say this is a dangerous game Satan playing, man, on God's people, man. And don't go for it. Please, you guys. Please, you guys, don't go for it. Don't go for the lies, y'all. And many people is gonna, many people are gonna go for it. Many people are gonna, because it's gonna be a lot of depression, and people are gonna want to do whatever it takes to maintain. But don't go for it, y'all. Please don't go for it.
Yes, there is harm in heart inflammation and all that, but it's a minority.
Christian, it's a reflection of publicity bias. So what I mean is, and this is why Channel 4 News and what you're doing is so important. What did Malcolm X say? Since Malcolm X said that there's no greater entity than the media. The media can make the innocent look guilty and the guilty look innocent. This also applies to how medical doctors receive information. At the end of 2021, when I had concerns around what was going on with mandates, by that stage, by the way, Christian, there was more enough evidence. You know this. The vaccine wasn't stopping infection or transmission. That was different to the narrative we were told at the beginning.
Well, hang on. What do you mean I know this?
Well, okay. So do you think, from your experience and what you said, that having COVID vaccine stopped people getting?
I'm not an expert. So I'm not going to get into the.
Sure. Okay.
But the basic fact, is that if you looked at deaths from association with the vaccine,
yes,
it was about 119, I think, in 1 year in 2023, and the claim on the lives saved was about 130,000.
Yeah.
Now, so for most people, these facts are pretty incontrovertible.
But they're based upon very, very biased, distorted information. From my perspective, when I'm pushing this, everything for me is about ethics and honesty and transparency. I have no links to the drug industry. I have no conflicts of interest.
What your critics say is that when you say you have no conflict of interest, well, actually, what's happened over the last...
On Fiverr, you can find the perfect freelancer to build your website. But you probably already know a guy who knows a guy.
3 or 4 years with you is that you've become very big with this group of people, very big in American media, very charismatic as a speaker, and there's a lot of money around that whole area as well. And now you've got power, you've got the job. So actually, you have had something to gain, and you've gained it. You've got real power now in America with a man in charge of health who is seen as a renegade, if you like, for want of a better word. Some people are much stronger than that, and that's what you got out of this.
Christian, we all have biases, okay? We all have our personal biases. One could argue, if I was playing devil's advocate, Asim's, become biased because he feels his dad was killed by the vaccine and he's on some sort of vendetta, some mission. That's why I felt it had to go through an independent peer review, where double-blinded, where the peer reviews didn't know who I was, didn't know, I didn't know who they were, and they agreed that my hypothesis had merit. Okay, so that's one thing. I have lost jobs in the NHS going back 10 years. I actually, in 2013, I published an article in the BMJ about saturated fat and cholesterol and statins, okay? there was a bit of pushback. I actually no,
Let's come to that.
you asked me about bias. I
Yeah.
lost my job. I worked for free in the NHS as a consultant. I then carried on with all this backlash, and I mean, how many people do that? By the way, right now, this role I've been offered.
But that benefits you, as worth saying.
This role,
Being an honorary consultant in the NHS
no,
gives
sure,
you a title that says, I am a consultant.
But I have pride. That's what I've worked hard for, and I'm here to put patient duty above anything else. So I have to keep trying
It's
to
not
do that.
entirely selfless, is what I'm saying.
But who is anybody in this world completely selfless? I'm not saying I'm completely selfless. I'm trying to do the best I can for my patients, and I'm also open to discussion and debate. The problem is, if you go to the root of the problem, Krishnan, is our whole system, unfortunately, has been corrupted and influenced by excess power of big corporations. That's really at the root of the problem, and all we're experiencing now is the downstream effects of that.
You see, you know what I mean? I want to say America been nothing but a corporation, man. And, you know what I mean? It's built on corporation. It has been built on elite dominancy. So in other words, you see, it's run on executive orders, man. It's America's this. It's a corporation. It is run on executive orders, y'all. So that's why that surprised me, you know, when Trump, you know what I mean, came and ran. You know what I mean, he wasn't coming to run for American people, man. He was running, you know what I mean, on agenda, on a basic order, on executive order. He wasn't running for American people, y'all. So that's why I tell people, man, whether you vote Democrat, Republicans, they're not running for American people. Each Republican, Democrat run on an executive order, y'all. That's why I say, man, when you understand that America is nothing but a corporation, that's what we gotta understand. It don't run, you know what I mean? It runs on agenda. It runs on a policy that, you know what I mean, these world leaders run on, man. They don't run for the needs of American people. That's what you gotta understand. Let's go.
That. And now we're in the situation where we've got this pandemic of chronic disease, we've got worsening disease, you know, in the UK, we've got life expectancy going down. One would argue, if doctors were actually doing the best to their ability according to the best available evidence, why is population health getting worse?
So, you know, given what you said about vaccines,
Yeah.
you know, are you going to go to America and say we should ban these mRNA vaccines for COVID, which is still being given?
The rate of harm is so high, and COVID is now no longer deadly, Christian. So even from a rational perspective, there's no better time than now to say, okay.
So what do you want to do? Are you going to go to RFK Jr. and say, you know what, you need to ban that?
I've already had conversations with Robert Kennedy Jr. about this. I think because I've got this independent role with Maha Action, absolutely one of the first things we're going to do is we're going to say, listen, this is the evidence. We need to pause. We need to maybe start getting them suspended in all these states. But also, Christian, what's really important,
So you will stop it.
that is the plan.
Where's the sort of the freedom of people to go ahead with it?
As in,
Lots of people believe in these
take it,
vaccines.
you mean?
Yes.
Listen, I think that the case.
You think they shouldn't have the right to take?
Listen, no one. Listen, it's a very good. Everybody should have that. That's exactly what we're talking about. We need informed consent. So, just to break it down, when a patient comes to me, one of the things I do, which is why people come and see me privately, is I engage in something which is called shared decision making. It shouldn't be controversial, but it is.
In terms of the other things you want to do in this new role, I mean, one of your other big skepticisms, you talk about the overprescription of drugs.
Of course.
And one of the drugs you think is massively overprescribed, one of the class of drugs, is statins.
Yes.
Are you going to wage war on the prescription of statins?
No.
In
I'm not
America?
going to wage war on prescription of statins. I'm going to wage war on lack of informed consent in their prescription. So there is the highest.
I want to say when they forced the vaccine, you guys, they never held no one accountable. Remember, you know what I mean? Anthony Fauci was questioned on 60 Minutes. And then this after 60 Minutes, he was brought to court. And you ain't after a while you ain't heard from Anthony Fauci. He stepped down. You ain't heard nothing from Anthony Fauci that was responsible for killing millions of Americans. So don't be surprised. They're about to force another mandate, y'all. They're about to force this, you know what I mean, vaccine, this pandemic. Don't be surprised, you guys. Remember what I said to you guys, man. Remember how they only doing this because they coming for our children, y'all. They pushing this gender to force on our children. They pushing this mandate, y'all. So y'all just remember what I told you guys, man. Cause they're gonna make this thing sound so good, y'all. They're gonna say, well, this pandemic, we just found studies that have a cure. It's because they gotta, you know what I mean? Y'all gotta understand, so many Americans gotta go. In other words, they gotta kill so many Americans, y'all. Tell y'all, man, y'all better pay attention, man. We already in the time, man. We already in the Revelation chapter. Read that Revelation chapter, y'all. He's gonna force people. No matter you poor, rich, great, he's gonna force this, man. See, they're already taking out FEMA. They're already taking out a lot of things, man. They're already taking off your Medicare, your Medi-Cal, your, you know what I mean, your WIC. What else is new, y'all? I'm telling y'all, man. Y'all better pay attention, man. Because you ain't gonna be able to buy, you ain't gonna be able to rent, you ain't gonna be able to get a job unless they require the vaccine. I was working at Amazon, and they were doing COVID testing. I was like, what? COVID testing? Nah. Just imagine, y'all. Just imagine they forced the vaccine only for you to work, y'all. Tell y'all, man. Tell y'all what they're gonna push, man. Y'all better tune in, man. Share this video and tune in, man. Let's go.
Standards of informed consent, Christian, are what I just told you before: breaking down information which is available, okay, on making sure patients are not coerced into exaggerating the benefits and exaggerating the safety. So all I'm saying is, what is the best independent evidence telling us?
But most patients just listen to their cardiologist, and the cardiologist says, I think you will benefit from taking this drug because it will reduce cholesterol and that will reduce the chances of you having a heart attack.
Yes.
And most patients just listen to that.
Yes.
So, if you're going to have an intervention that is meaningful, you're going to have to be quite radical about it and go against all the mainstream medical opinion.
Well, it isn't though, you see. I will cite you 2015, British Medical Journal. I'm the first author, chair of the medical colleges, chair of the GMC. We actually wrote this is what we should be doing in medicine. It just hasn't been implemented yet. Do you know why? Because
well, that's what I mean. There's one article that you wrote, but I mean...
No, but that was a campaign.
If you ring every cardiologist in London, most of them won't agree with you on statins.
Well, it's not a question of... Yes, that's maybe true, but the question is, it's because we are not conditioned and trained to think in this way. Christian, it's just a question of training and changing the thinking and the approach to medicine. And it has to change from being more paternalistic and more... So,
But now you're in a position to do something about it in America. So what are you going to do?
Well, listen, I think we just want... What most important thing, if we want to improve quality care, we need greater transparency, greater accountability. We need independent evaluation of the scientific evidence. The problem at the moment is we don't have that. I'm a practicing cardiologist where my patients invariably within weeks of just changing their diet alone can send their type 2 diabetes into remission and come off the pills, bring their blood pressure down. So it's simultaneously empowering the profession to...
But that is literally what every GP does. If if you go to the GP with pre-diabetes, they don't stick you on drugs. They tell you to change your lifestyle.
They do, but how many of them actually have got outcomes where they show,
Because it's really hard. That's the truth, and that's why we have a lot of drugs.
It is hard. It is hard. You're right. Some people can do it, and some people find it difficult. And that brings me to something else. The bigger issue, the broader issue, the base of the problem is actually what determines our health is socially and environmentally determined. So when you talk about the dietary changes, we've got this oversupply of ultra-processed food. Even 70% of the food purchased in hospitals, Christian, is ultra-processed.
Yeah, and this is where you're mining a rich seam, and lots of people agree with you.
Exactly. So it needs to be both. So we need to educate, and absolutely that needs to be part of the discussion. But the only way the education is going to work effectively is if we actually work on changing the environment. And for example, the ultra-processed food stuff, I've said ultra-processed food is the new tobacco. Yeah. And if we implement changes, I advised Matt Hancock on this during the COVID pandemic. He said, because I was somebody that was able to highlight links between COVID and obesity, and he asked me for advice when this was reported in the news. And I said, Matt, the single most important thing you can do, in my view, to potentially reverse obesity, the trend of obesity and chronic disease within a few years, is treat the same things that we did for tobacco control, addressing the availability, the acceptability, the affordability, so taxation, banning tobacco advertising, public smoking bans. If you apply the same principles to ultra-processed food, you will see declines within a few years in terms of chronic disease and improvements in population
health. So is that what you're going to be pushing for in America?
Absolutely.
To tax the big food companies, because they are very powerful.
Yes, they are.
In America, and they will resist it.
They will resist it, and we expect that to happen. But I think what's happening, we're now at a
you try taxing Coca-Cola.
Yeah.
Good luck with that one.
Listen, we have to at least put the arguments forward about what we think is going to be best practice, and it's going to need media engagement, it's going to need public engagement, but Christian, people are fed up. Now, there's another big problem with all of this, which really upsets me. Lack of...
You see what he's saying? The people are fed up because they see this. People see straight through this agenda, man. That's why people are so fed up, man. The people are seeing this agenda, the Satan agenda, man. I'm telling y'all, man. The people are so fed up, man. I'm telling you, they finna force another vaccine, man. Y'all better be ready, man. You see martial law protesting it. I'm telling you, man, Satan is knocking down the middle class, man. Y'all better be ready, man. I better be ready for this next project 2025, man. I'm telling y'all, man. The days is here, man. The days is here that the Most High God, he's not playing. He's in the midst of time, man. And he's coming in this midst of time, man. So y'all better be, man. That's why I always tell you guys, man, be self-vigilant, man, and stay aware, man, of your surroundings, man. Cause tell y'all better be ready, man. Cause they finna force this. You know what I mean? This pandemic, man. I'm telling y'all, man. This pandemic is gonna be worse than the last one they had. So, I'm telling y'all better take heed, man. It's coming. It's coming.
Reduction in trust in the medical profession in the US, and I'm sure this the situation because of the COVID pandemic.
But you're feeding that. Because you're telling everybody you can't really trust your doctors.
I'm not feeding that at all. They're doing it themselves. The whole handling of the pandemic has been atrocious.
Well, if you go on Russell Brand's podcast to talk about the lack of trust and all the rest of it, you are feeding into all of those conspiracy theories.
No, it's not. Well, it's not conspiracy theory. The issue is we shouldn't listen. For me, I don't want to undermine trust in the profession. But if you actually look in America, there was an all-time high trust in the medical profession in April 2020 at 74%. It's now down to 40%.
I'm not surprised, because we live in a world in which social media fragments everything.
Yeah.
There are lots of people like you saying you can't trust what's going on at the
No,
moment.
Christian, I'm sorry. I think it's legacy media are losing trust, and I think that's one
That's
of the...
also true because of everything that's going on. Lifestyle is the big thing that could make a big difference to people's health outcomes, and that's been your big campaigning issue for many, many years. And you've just talked about how diets can rapidly change things, in a similar way that drug therapy can. But you also know that the biggest obstacle to that for a lot of people is poverty, housing.
At Nissan of San Bernardino, we make driving the perfect car a reality. With a large inventory of new and certified Nissan, you are sure to find the right car. We accept all credit applications and and offer top value for your trade. And with our quality service area, your car will receive the best
income, the ability to afford to buy fresh food rather than ultra-processed food.
Yeah.
That's the biggest challenge that you're going to face in America, isn't it?
Yeah, I think you're right, Christian, and I'm glad you raised that. We have to change the narrative. So part of it is lack of knowledge, actually. You know
But
that.
you do know which government you're going to work for, don't you? And what they're going to do.
But actually, to be very precise with you, I'm not actually working for the government. In many ways, you know.
Well, you are really. I mean,
Well,
I mean, maybe not technically. But
indirectly,
I mean,
there's influence there, but it isn't actually, you know, precisely. I'm not actually working with the government. It gives me independence to basically say what I want to say, what I think is best available evidence, which is good in a way. The other thing to mention, Christian, as well, in terms of like bias, is fine. This particular role for me is unpaid. So because I care so much about this issue, I was willing to actually take an unpaid role for now, to try and help them get things moving forward. Hopefully, at some point, I'll get some remuneration. So I'm not obviously doing it for the money.
but you've got an administration that is looking to make massive cuts to things like housing. Are you going to tell them they're wrong? That will lead to, more chronic disease?
If that's what the evidence tells us, yes, I will absolutely.
Well, it absolutely will. It's obvious. You can say that for now, because you know that poverty leads to more chronic disease.
Absolutely, but I mean, I think the issue, as far as I'm aware, I'm not aware of this particular data on them cuts to housing. But part of that discussion, I've had discussions with senior people in the White House.
I mean, these are all live. They're not necessarily announced, but they're live debates. And the Republican Party also wants to cut Medicaid. You know, a lot of people in that party. I mean, that's going to affect people's chronic illnesses, isn't it?
I agree, and my role is to basically reflect as a doctor, not ideologically, but what does it mean to
What
be
will be the
healthy?
effect?
Absolutely.
The other big issue in America and all around the world is the whole question of weight loss drugs, these GLP-1 drugs, as they're called. And you are skeptical about them. Why?
I think this could potentially be another public health disaster. I mean, I've got patients and people I know who have suffered quite serious side effects.
I mean, there's going to be a massive public demand for it. There already is, isn't there?
Yeah,
So that's going to be a very unpopular
there is.
message in America.
There is, but it's being fueled. But at the end of the day, people still want the truth. For me, I still think that almost certainly the best approach is going to be lifestyle. And I fear this is going to end up being a public health disaster, to be honest.
One other issue in America that's very controversial worldwide is the Robert Kennedy view on vaccines and autism. Now, we know what happened in this country with wild claims about the cause of autism and MMR. It was totally discredited. There's no evidence that vaccines cause autism. And Kennedy has reopened this debate and is now having a big inquiry into it. He's going to use you as his sort of medical bolster on that, isn't he?
So I think he's already reached out to independent scientists that he knows to look into this. So I'm not directly involved, first of all, in that particular analysis. But
Do you agree it's nonsense?
I think that there is enough of a concern out there. You've got a massive problem with vaccine skepticism now, Christian, which isn't good. I honestly think, and by the way, I think we need to have a conversation that all vaccines are not the same. So the question is, this will hopefully give us some answers about whether or not there is a signal. And let me just break this down.
But he says it's an open inquiry into vaccines.
Yeah,
but
but-
he has said.
So I've been given a role as Chief Medical Advisor to Maha Action, which is a non-profit organization that essentially works at state level to do research, educate, and legislate for the purposes of making America healthy again.
That's what Maha is.
Absolutely.
And what will the role involve?
My role essentially would be to synthesize and analyze data on how to translate the best evidence into policy for reversing chronic disease, because that's obviously the main focus of MAHA. All the different levers that need to be pushed, whether it's around legislation on ultra-processed junk food, whether it's on how to improve quality care within the healthcare system itself, because there's a big problem of over-medication, whether it's about also highlighting issues around lack of good quality data or independent data when it comes to doctors giving prescriptions.
So as advisors, or is there power?
No, there is, but we are essentially, in many ways, we are an influence, an educator, and a lobbying group for the purposes of MAHA. So we will be speaking to senators, we will be having
Trying to
conversations.
persuade states to take these measures.
Absolutely. So we will have the ear, if you like, of the senators and congressmen.
I mean, it's quite an amazing sort of transition for you. You know, and you've kind of got in with this whole movement in America over the last few years, I suppose, through COVID, isn't it? I mean, how do you know RFK Jr.?
really good question. So in 2022, and the backstory here, Christian, is I was somebody, and it's really important to get this clarity.
You know, people are so skeptical. You know what I mean? They are so skeptical, like whether they can believe this vaccine can have a cure. I'm telling you what's going to happen. It's going to allow many American ways questions. Some of them going to feel that it's going to have a cure from brain aneurysm, and remember what he was saying, where Robert was saying that the vaccine they did call aneurysm, but just remember they're going to try to they're going to try to juice this thing up. They're going to make it sound good for you guys, man. That we found new study that it had a cure for cancer. Bronchitis. You're gonna hear all kind of things, y'all, because they gotta force this on many American people. You're gonna hear a lot of things, and they come in and forcing this vaccine on our little ones and on the older people, man, because they're gonna tell people that this new study we found is gonna have a cure for cancer. It's gonna have a cure for a lot of different things, man. And they're gonna tell you guys that we found new study that it have a cure for health problems. I'm telling you. So let me be the first one to tell you guys this, man. I'm telling y'all, man. Don't go for it. I urge you guys, recommend you guys again, and I ain't gonna keep stressing it, but I recommend you guys read that whole Revelation. Just read it. If you want to have an understanding of something, read that Revelation. I don't care if you got to read it 2 or 3 times. Read it. I recommend you read it over and over. Get a clear understanding of what's going on, man. And you want to get a clear idea of why they forcing this. Why they got to force this. You know what I mean? Marking the beast. Telling you guys, man. I recommend you guys go into that Revelation and read every bit of it. Let's go.
In the narrative as well, from my perspective and for people to understand this, the early 2021, I was one of the first people to take 2 doses of the COVID vaccine. I assisted in a vaccine center. I felt I was doing it not because I felt I was at risk, but because it was my duty to protect patients. So for me, there was really no question in my mind there would be an issue. I was a bit skeptical at efficacy, but I didn't think there was going to be harm. Things then evolved. By the summer of 2021, my father, who was a vice president of the BMA, had an unexpected cardiac arrest and died. There was actually an ambulance delay involved in his death, and that was
Palace chap. He used to come on the program.
Yes, absolutely. And obviously, he was the last survivor of my immediate family. It was obviously devastating for me, but I was shocked, one, because he was a very fit guy, and two, I was also involved, unfortunately, in the circumstances where he had a witness cardiac arrest with 2 doctors doing CPR. Ambulance was on its way. He should have survived. The ambulance was delayed. So that obviously contributed to his death, but his post-mortem findings didn't make any sense to me. He had severe coronary artery disease. There'd been an acceleration compared to previous scans. Several months later, research was published in one of the prestigious cardiology journals called Circulation, and they basically showed a mechanism of how the COVID vaccine increases inflammation of the heart arteries, which could accelerate heart disease. And it was pretty interesting research, and I thought, this makes sense now. If this is true, we are now going to see increasing death rates from heart disease and heart attacks. I spent months looking into this into detail because I knew I was up against something really big here, a complete change in the narrative, me reluctantly having to change my mind, having felt almost angry to some degree that anyone was questioning the vaccines. I had to go through that whole psychological process, but the evidence was there. I published in a peer-reviewed journal, independently analyzed, so I maybe had my own bias because
Y'all better listen up, man. I'm telling y'all, man, they're gonna try to tell y'all, they're gonna bring it out, they're gonna try to tell we got a cure for heart disease, cancer, and why are they pushing it? Because they pushing it on your little children and on the older people, man. For the older people, because look, y'all, they ain't gonna be for the older people, they for the most older people, it's gonna raise a lot of suspicions, or you know what I mean, it's going to raise questions. Most of them is going to be just willing to take it. They're going to just hear, you know what I mean, the lies. I'm telling you, man. From the old people that got, you know what I mean, cancer, heart disease, heart failures, and all that, they coming. I'm telling you, they're going to push this and force a lot of, you know what I mean, old people to take it, man. I'm telling y'all, man, y'all better pay attention, man. So they come into this, you know what I mean, time to force this on your children's and on your, you know what I mean, on your older people, man. Let's go, man.
My father died.
I mean, we've got to be careful when you talk about prestigious magazines and peer-reviewed journals, because there's lots of different journals.
There is.
There are very established journals, like the British Medical Journal.
Yeah, it's from heart disease and heart attacks. I spent months looking into this into detail because I knew I was up against something really big here, a complete change in the narrative. Prestigious cardiology journals called Circulation, and they basically showed a mechanism of how the COVID vaccine increases inflammation of the heart arteries, which could accelerate heart disease. And it was pretty interesting research. And I thought, this makes sense now. If this is true, we are now going to see increasing death rates from heart disease and heart attacks. I spent months looking into this into detail because I knew I was up against something really big here, a complete change in narrative, me reluctantly having to change my mind, having felt almost angry.
See, with the COVID vaccine, it increased heart attacks, heart disease, heart failures. I tell y'all, man. I tell y'all better, man. Y'all better read between lines, because they're gonna tell you, they're gonna flip it, y'all. Watch how they flip it around by next year. How they found new studies that have a cure for cancer and heart disease. I'm telling y'all, they're gonna flip it around, y'all. Satan had to flip this agenda around and make a lot of people believe it that have a cure. I'm telling y'all, man, don't go for it. Don't go for it. Let me be the first one to tell you. Don't go for it.
To some degree that anyone was questioning the vaccines. I had to go through that whole psychological process, but the evidence was there. I published in a peer-reviewed journal, independently analysed, so, you know, I maybe had my own bias because my father died.
I mean, we've got to be careful when you talk about prestigious magazines and peer-reviewed journals, because there's lots of different journals.
There is.
There are very established journals, like the British Medical Journal.
Yes.
There are offshoots of that. There are things that are owned by, so... And I know you kind of want people to say, you know, when you use that language, that this is kosher, if you like, for want of a better word.
You're absolutely
they're
correct.
all disputed as
You're
well.
absolutely correct. Long story short, for me, it became clear that there was good evidence saying more harm than good from the beginning. We should at least pause. I went on GB News. As soon as I come out of the studio, I get a missed call. I call it back as an American number. I'd had no interaction with this person before. It was Robert Kennedy Jr. He got my number from someone. He'd hear what I'd done. He said, I've seen Dr. Malhotra. Thank you for your courage. This is Robert Kennedy Jr. And after that, we then built a relationship in the sense I went to America, I gave talks.
And you've become big in that whole sort of sphere of that, you know, that sort of MAGA crowd.
Yes.
Tucker Carlson, Russell Brand, not that he's MAGA, but, you know, that whole sort of, that sort of, it's an alternative media world,
Of course.
which has really built your profile. It was your turnaround on the vaccine and your claim that it causes more harm than good.
Yes.
That is obviously a view that is not held by the vast.
You see that? You see what he's saying? It caused more harm than good, man. It caused people harm, man. And watch how they gonna reverse this thing around, man. Tell y'all, man, we just found new studies of it that's gonna have a cure for a lot of Americans. I'm telling y'all, man, it did more harm than good, y'all. y'all not listening, man. Y'all not listen. I need y'all to listen, man. They tell me, they put it in your face. It does more harm than good, y'all. We're about to be in a rocky year, man. We're about to be in a rocky year. I'm telling y'all, man. Y'all better take heed to this, man.
Majority of medical opinion or academic opinion or the World Health Organization or any of those sort of bodies. You think they're all wrong?
No, I think, listen, I don't think they're all wrong. The people that I've interacted with who share my concerns also can include the new director of the National Institutes of Health, Jay Bhattacharya.
Yes, but who's also a very controversial figure who was behind the Barrington Declaration during COVID and all of that. I mean, you know, he's a type.
But he's been proven to be correct. The mainstream...
What I'm saying is that the mainstream opinion doesn't share this view. They say it's obvious. Look at the deaths from COVID. It is clear that the vaccine did more good than harm. Yes, there was harm. It was in small cases. Yes, there is harm in heart inflammation.
So you got one person say does more good than harm, then you have the other one says does more harm than good. Which one you gonna believe, y'all? But anyways, man, for more updates, man, please stay subscribed to this channel, man. Please stay connected, man. Subscribe to the channel, man. We out, man.